Could anyone give me advice on which doctor or clinic would be reliable to do a consulting appointment? I have uneven asymmetrical eyelids, and I would love to get surgery done if possible. I'm no expert on this, so I don't know what would be the main cause for this. I live in Toronto, and I would like, if anyone could give me advice, on which doctor or clinic would be reliable to do a consulting appointment. If someone could also analyze the cause of this and what my situation is, that'd be great too. Thank you.
Thank you for your question. You submitted a single photo with your glasses on, and you're concerned about asymmetric eyes, and you want advice on making a recommendation on a clinic in your area regarding your eyes. And you're looking for also some information based on the photo you submitted. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize also in Asian eyelid surgery, and certainly the situation with the photo you submitted is something I'm quite familiar with. I can give you some guidance as to how to find a colleague in your area to assist you with your situation. So to begin with, your concern is about asymmetry. So when I look at your photo, I notice that there is essentially one eyelid, the right eye, that looks a little bit lower than the left eye. Now, since you're wearing glasses and I can't get as quite of a good view of the pupil, but I would suspect that the asymmetry is related to one or two factors that affect the position or the appearance of the eyelid. The first is the absence of an eyelid crease. That means that as opposed to having a defined crease, there's just a monofold or a monolid. And it means that the skin doesn't have a crease, and that is a normal variation, and it's not unusual to have that difference between the two eyes. The reason there's an eyelid crease for those Asians who are born with creases, and it's about 50%, is due to the connection between a muscle called the levator muscle. This is the muscle that lifts the eyelid and that sends fibers that are attached to the skin that create this crease. The second factor is the actual muscle itself, again, the levator muscle. The word levator is like the word elevator. It's the muscle that physically lifts the eyelid when you look down, when you look up. Now, this muscle, if it is in any way stretched or not fully developed, as in the case of something called congenital ptosis, then what you have is a condition called ptosis. Ptosis means the eyelid is drooping, and that's the position of the eyelid relative to the pupil. Now, this means that not only would there be an indication for addressing the eyelid crease or the absence of a crease, but also to do something to elevate the eyelid or a ptosis surgery. Now, in our practice, we do a lot of this, and part of, just to familiarize you with the process, ptosis surgery is performed under local anesthesia with light sedation, and as well as Asian blepharoplasty or Asian upper eyelid surgery also is done under local anesthesia with light sedation. When we do ptosis surgery, we'll actually sit the patient up during surgery to adjust for the height, shape, and contour of the eyelid. Now, in terms of making a decision as to who to find in your area, I would suggest that you look for an oculoplastic or oculofacial plastic surgeon. This is someone like myself who has training in eye surgery followed by specialty training in plastic surgery of the eyes. What may be also a differentiating factor for you is their relative experience with Asian eyelid surgery. There is no question that there is another level of surgical decision-making that is required based on the difference in the anatomy between an Asian eyelid and a non-Asian eyelid. So essentially you want to be able to screen for doctors who have experience with Asian eyelid surgery and Asian eyelid ptosis surgery. So begin with making those calls or doing your online research for doctors in your area, and you should be able to identify a colleague who can offer this service to you and who has that level of expertise and experience. So I hope that was helpful. I wish you the best of luck. Thank you for your question.